Launching a capital-intensive healthcare facility from scratch in a highly unpredictable post-pandemic environment carries massive, unquantifiable financial risk. Traditional business planning tries to manage that risk by optimizing for expected returns. That method works in stable historical markets, but relying on a rigid forecast leads to collapse when variables shift unexpectedly. 70% of new healthcare ventures, mergers, and acquisitions fail. Most of these losses are tied directly to poor communication and inflexible planning structures that cannot adapt to reality. Consider a hypothetical new clinic launching here, in the densely populated, unpredictable urban environment of Bekasi, West Java. When the future is entirely unknowable, attempting to build a business around predictive models becomes a direct financial hazard. To survive this, expert entrepreneurs abandon prediction. Instead, they use a strategic logic known as effectuation to control the controllable. The logic is straightforward. Causation assumes that if you can predict the future, you can control it. Effectuation assumes that if you tightly control the present, you do not need to predict the future. We are going to apply this logic to a specific proposal, the Bekasi Inpatient and Vaccine Clinic. Instead of guessing market demand, this case study systematically dismantles venture risk using the 5 rigorous principles of effectuation. By applying these steps, business creation moves away from high-stakes gambling and becomes a process of systematic engineering. The first principle is bird in hand. Effectual entrepreneurs do not start by searching for an abstract gap in the market. They start by auditing their existing inventory of means. Those means fall into 3 strict categories: who you are, what you know, and whom you know. Look at the top section of this project document detailing the founder's profile. We see an analyst with a tactical network, ER doctors, hospital admission staff, and direct connections within the National Health Insurance System, BPJS. That existing network immediately dictates what the clinic will offer. By focusing strictly on acute care and vaccines, the founder leverages existing medical relationships without spending a single dollar on speculative market research. Utilizing an existing network removes the friction of acquiring untested resources, grounding the entire venture in reality on day one. The second principle is affordable loss. This directly flips the traditional method of calculating maximum expected upside. Instead of optimizing for profit, the entrepreneur calculates the absolute maximum downside they can tolerate losing. They then design the physical and operational structure of the venture to guarantee they never cross that line. This chart visualizes the total projected investment for a standard facility at 800 million rupiah. But notice the hard red limit drawn at exactly 25%, or 200 million rupiah. That is the maximum allowable financial exposure. Imposing that strict 200 million rupiah limit forces a physical redesign. Rather than building a large 20-room hospital, the plan shrinks down to a highly constrained micro-facility with only 5 to 7 rooms. This reduced footprint means the clinic cannot rely on expensive, long-term infrastructure. Instead, it is forced to prioritize high-turnover, cash-generating services like high-volume vaccinations to survive. Calculating an affordable loss prevents financial ruin, while forcing the design of a leaner, more resilient business model. The third principle is lemonade. This requires treating bad news and operational surprises as strategic inputs rather than problems to avoid. One of the most destructive operational surprises in healthcare is patient uncertainty regarding insurance status. It frequently causes patients to leave against medical advice, which immediately destroys projected revenue. This document outlines a specific mitigation strategy for an acute abdominal pain scenario. Before any clinical action is taken, a dedicated educator deploys a structured 5-step communication protocol with the patient's family. By executing this protocol, the outcomes shift drastically. The family agrees to general funding upfront, the patient receives immediate treatment, and the risk of the patient leaving is neutralized. Addressing the worst-case financial scenario upfront builds trust and stabilizes the situation by eliminating unknown variables. By engineering these transparent communication protocols, the clinic transforms an unpredictable operational vulnerability into a reliable system that builds deep institutional trust and guarantees cash flow. The fourth principle is crazy quilt. This is a stark contrast to traditional competitive analysis, which treats external entities solely as rivals to be outmaneuvered. Instead, effectual entrepreneurs proactively construct a network of self-selected stakeholders who agree to co-create the venture, thereby distributing its inherent risk. This network graph maps out the primary anchor partner for the Bekasi Clinic, BPJS Kesketan, the national health insurance provider, representing 250 million members. Integrating BPJS early is a mathematical imperative. It secures a guaranteed, recurring baseload of patients, which establishes a hard floor for the clinic's monthly cash flow. These strategic partnerships act as structural tethers, actively insulating the fragile startup from the volatility of the open market. The final principle is pilot in the plane. This reinforces the core effectual belief that the future is not predicted, it is actively made by human action. The founder must act as a pilot, making continuous, real-time course corrections based on immediate data streams, rather than blindly following a rigid 5-year forecast. This strategy table breaks down the rollout into immediate, actionable milestones. The launch phase aims solely at 5 rooms and 50 vaccines a month. Month 1's micro-launch is designed to scale methodically, based entirely on proven traction, with a long-term target of 20 rooms across 5 branches by year 3. Scaling effectively requires tight control over present parameters, expanding the system only once it proves its own stability. Effectuation operates as a tactical defense mechanism against failure. Implementing these structured communication protocols directly addresses the primary cause of organizational failure. By standardizing these interactions, ventures can achieve the 40% higher success rate observed in organizations that prioritize transparent, structured stakeholder communication. In complex, unpredictable environments, the goal is not to predict the storm. It is to engineer a ship capable of utilizing the wind. Control is the ultimate antidote to uncertainty.